Next to me, and owner of a small, as you describe, mom and pop insurance agency joining me. You're based in Long Island,
Yes.
even though you're on set here in New York City. And from D.C., we have Mike Brey, the owner of Hobbyworks. I guess like a toy store, a fun little store, right? 5 locations in Maryland. You employ 48 employees, of which I believe you give a dozen healthcare. Radically different views. Mike, you are for the new healthcare law. Steve, you are against it.
Yes.
So let's, before we begin battling this out or amicably discussing it, let's take a listen to something President Obama said during the second debate at Hofstra University. Let's take a listen.
So 4 years ago, I stood on a stage just like this one. Actually, it was at a town hall, and I said I would cut taxes for middle-class families. And that's what I've done, by $3,600. I said I would cut taxes for small businesses, who are the drivers and engines of growth. And we've cut them 18 times. And I want to continue those tax cuts for middle-class families and for small businesses.
All right, Mike, we'll start with you. Do you agree that everything the president said he's done, that he has truly done?
I do, for the most part. This administration has been, to my eyes, one of the most small business-friendly administrations since I started my company nearly 20 years ago. When you look at a lot of the things that they did with the original Small Business Jobs Act and then the extension of that in 2010, it was chock full of nice little tidbits for businesses like mine that went right to the bottom line. Things like the changes to Section 179 deductions, changes to the loss carryback rules. I mean, these were things that we were able to use right away, right in the heart of the recession. And if there is anything that this administration has done for business, in my view, it's focus on small businesses.
Okay. Steve Flatteron.
Yes.
Do you agree that this has been a small business-friendly administration?
Not at all. Just look at our economy. Look what's happening to small businesses and large businesses in this country. This is just this is government taking over a whole industry. There's nothing, it's a lot of good buzzwords about, people want to feel good that everyone will be covered, but it's going to cost, I always ask the simple question, where's the money going to come from to pay for these new mandates? Mm-hmm. It comes from somewhere. They're not talking about that. There's no specifics, and I don't believe it's going to work right.
Okay. Regarding the health care law.
Yes.
Do you offer any of your employees right now health coverage?
Right now, no, because we're independent contractors in our office.
Okay. All right. So this isn't something that you would consider doing?
Not for myself, but I sell group medical insurance. In our office, in between our practitioners, we have a couple hundred small business clients on Long Island and in 5 boroughs.
So what are they telling you about offering health insurance?
They already are flipping out. I'm finding a lot of times already where there's these small businesses, if they're a small law firm or a local deli, their spouses are getting sometimes local government jobs just to cover the medical, and they're dropping the whole plan in the business. Their businesses are so bad right now, they can't afford the increase. And this is just going to be another level of taxes. Just look into the Medicare system alone.
Yeah. Okay. But Mike, I think you disagree. You're kind of into this health care law, right? You say it's going to be good for you and for your workers. Explain.
Well, yeah, I got into this health care thing because I served on the board of directors of a local hospital years ago, so I started paying attention. But the fact of the matter is that, I'm getting a little bit of an echo here. The fact of the matter is that this most of what you're hearing about this and objections from small business owners are based on misinformation, myths, etc. The fact of the matter is, it is for businesses that have under 25 employees, it's not a bad thing. It's a good thing because it enables them to provide health care where they weren't able to before. And to answer the gentleman's question, where's the money going to come from? Well, it comes from people who already want to have health insurance and weren't able to afford it before. And so they're the ones who are paying for it.
How will this lower your costs, though? Or will it?
Well, we're in Maryland, and Maryland mandates already small group. So a lot of what you have in this health care law, sort of, some of the things, the continuation of coverage, pre-existing conditions, etc., is already mandated by Maryland. And because Maryland is one of only a few states that do that, we don't have a lot of choice.
Okay.
In fact, we only have 3 choices in health care now. So for me, it'll be great because if you want to be in the healthcare business, you're going to have to offer a slate of plans. And so in Maryland, it will be much more competitive, and we'll have more people to choose from. And I expect it to come down.
Okay. And Steve, when I was talking to Kate Rogers earlier, and I said, you know, this is going to be interesting to see the 40-plus employee businesses trying to stay under 50 so they don't have to employ coverage. And I saw you shake your head. You were like, yeah, that's right. How come you really think that's going to happen?
Business owners,
we're not going to hire.
In New York State, we have community rating law, too, where people have health conditions. They're covered. They're covered for those conditions already. We have our local congressmen announcing how they're going to solve this problem. It already has been in this state. But the problem is, right now in New York State, full-time employees considered as low as 20 hours. We have so many business owners already that are just...
As low as 20 hours?
20 hours in New York State. For small businesses, you could be on a group medical plan. And you already have now where a lot of employees have people for 17 and a half or 19 hours. They already try not to put on a plan. At first, the mandate will seem like it's a great way to get inexpensive insurance because it'll just be cheaper to pay the fine, it seems like. But what's going to happen is really, that's just sort of, I look at it as the plan of the government taking over the whole healthcare industry. If you look at past history in New York State, before the community rating law came in the 90s, Blue Cross was the plan of last resort. They got different pricings when they went to the hospital. They were much cheaper, and the other insurance companies were taxed to help try to bail them out. So it gets to, in the long run, the insurance companies start fleeing the market, and you're forced to go to the government plan.
Well, it kind of is the government running it, because on Friday there's this deadline where the governors across the U.S. have to say whether they're going to offer a state exchange. So if a company doesn't provide health insurance, that consumer can shop for an exchange in that state. So you're not required to do it, then the government would offer the exchange. So, I mean, essentially...
How is this...
Go ahead.
How is this government running health care? It's not government running health care. What it is government providing an opportunity for all of this gentleman's independent contractors to go out and get health insurance. The government's not running anything. At the end of the day, you're still going to the same insurance companies you always went to before. We're not going to have people fleeing the market because now the entire country will be the market. And so the idea that these insurance companies are suddenly going to pack up and go out of business is preposterous. And the idea that the federal government is running health care is also preposterous. All they've done is what many states have done, which is lay out certain guidelines, and then they're providing, hopefully through the states, these exchanges where independent contractors like like he employs and people who are self-employed can go out and get health insurance, and small businesses can also participate, can go to these exchanges and look and say, hey, can I get a better deal here? Can I get a better deal there? So the very idea that this is the government running healthcare, I completely object to.
Okay. Appreciate your opinion, and point well made. Mike, follow-up question for you. You offer 12 employees healthcare out of 48. Are those numbers accurate?
Yes, they are.
Are you going to extend healthcare coverage, maybe increasing some hours so more people would qualify? What's your plan?
Sure. Our plan is, first of all, mostly I have retail employees, lots of part-timers. Those people tend to be lower wage. So while we offer healthcare to a lot of them, many opt not to take it. So we're hoping to provide, to give those people who opt not to take it for cost reasons, the opportunity to access healthcare. I have plans to open 2 stores next year. We are not going to slow down hiring employees.
So you'll go above 50. You're at 48 and you will go above 50.
Yeah, we absolutely
Nice.
will go above 50.
Okay.
But like 96% of businesses over 50 employees, we are already offering health insurance. So the pool of businesses that are not offering health insurances is actually a very small percentage. We're talking about 4%. And you take a business like this gentleman's insurance business, he's got independent contractors. So this doesn't affect him anyway. So this is an opportunity for those people to go out and get health insurance on their own. It doesn't affect his business one bit.
Well, but what Steve is saying, I hear every Wednesday when we do the Fox Business Small Business Center.
Sure.
So it's not just Steve saying this, it's many people saying this. So Steve, do you want to respond?
One, it affects my hundreds of clients that are buying these products. And they keep on saying these buzzwords of like why do we want to go to a national plan? The idea was how are we going to get the expenses down? There's nothing addressing the expenses. This is a government, another tax. Look at the Medicare system. In New York State, when you sell a senior above 65, because the Medicare doesn't cover everything, they have to get Part B they have to pay for, they have to get Part D for the drug plan, and a supplement. An average senior, even though they were paid all their life, all these taxes to Medicare, they pay about $400 a month per person in premium, more than $400 a month. So you're still going to have, even these government plans with these additional taxes, the supplements are as much as individual plans right now. I have a lot of small business owners who stay on the group HMO because it's the same price as all the supplements, and they don't have to have a donut hole in their Part D on their drug plan. And they're able to so there's nothing here is addressing getting the expenses down, and it just look again all these programs are run by the government. What's happening in the New York area just with LIPA, MTA, the government cannot manage things. We want capitalism, private companies.
Right.
Mike, all right. Well, we're back to this, the government managing things. The government's not managing things. B,
true.
We are addressing the costs here because, the biggest hidden tax in health insurance are people who don't have insurance. The fact of the matter is when people don't have insurance, they still use the healthcare system. Yeah. And that's what's not being paid for. And so this does address that in a significant way because now, though people who refuse to get health insurance, they will be paying into the system a massive amount of money that we didn't have in the system before. And so again, the idea that this is another government-run program that's going to somehow fail, that is flawed. And by the way, there's plenty of government-run programs that work great. The fact of the matter is you and I, Laura, can go get a hamburger at McDonald's or a restaurant or from a roadside cart and have a reasonable expectation we're not going to die because we have the USDA. And the fact of the matter is that that's an example of a government program working really, really well.
Mike Brey.
So they are out there.
So much. Thank you for your opinions. And good luck to you, the owner of Hobbyworks in Maryland. Steve Flatteron, thank you so much for coming on as well. Appreciate both of your time this morning. Okay, we're going to go to a break right now, and we're going to be back with the final guest talking about how all small businesses, we're getting away from healthcare for a little bit, although I see a lot of you chatting about healthcare, talking about how to best use social media and different social media tools you might not have heard of that can really get your small business up and running.